Well, with so many countries, cities, and communities seeing impacts of the coronavirus outbreak, we are witnessing different ways that governments are tackling the issue. To break down how officials in the U.S., especially in Washington and Oregon, are handling that outbreak, we have Oregon State University professor Chun-Huei Chi joining us via Skype this morning. Good morning, Professor.
Good morning, Jenny.
Good morning. So, Governor Kate Brown declared an emergency in Oregon because of this outbreak. What does this mean to Oregonians?
Well, that means for Oregonian, we are into a new stage. This COVID-19 is with us now. And I think most Oregonians are already mentally prepared. And we are just now living in this reality.
Does it mean that we'll get more supplies, or like literally what does it mean for us when that state of emergency is declared?
That means that the health authority can mobilize more resources, more volunteers, and also they are trying to make the tests more widely available. One of the reasons we are in this crisis was early on in late January and February, the CDC was not doing enough tests. So for nearly 1.5 months, we didn't know how many people were infected. And that kind of caused of this crisis, that because they are all around us.
And so in your opinion, what is the right time? When is the right time to declare an emergency in a state?
No, this is the right time to declare emergency. What I meant was the reason we are in this crisis was because early on the CDC was not doing enough of testing of people at risk. For example, up till a week ago when CDC began to distribute new testing kits, CDC only tested 472 cases, when the actual number CDC should have tested should be, in my opinion, at least 100 times of that number.
Wow. So with the outbreak being deadly in Washington, our neighbor state, what makes the government response there different to Oregon?
Well, Washington take a more, because of their kind of the hub of the U.S. emergency, most deaths occur there. So they're taking a more stringent steps, for example, in terms of quarantine, in terms of identifying the places, their locations, confirmed cases has been.
All right. Well, Professor Chi, thank you so much for your time. And by the way, we do have an entire section on coin.com dedicated to the coronavirus, including facts, myths, and what you should know and do to stay healthy. Just go to coin.com/coronavirus.